Hello, thanks for joining us again. I'm Holly and this is Jamie, and we are with Dementia IQ, powered by the James L. West Center for Dementia Care in Fort Worth. Today we're going to talk about tips for talking to a loved one who is aging. When you start to notice changes in your loved one, your first instinct might be to fix it. But the best approach is actually going to start with listening, observing, and being respectful about their perspective. Jamie, what are some things that we should do when we're talking to someone who's aging?
Some great things to do is to use the I statements. I feel overwhelmed. It can really use some help. Or I have noticed some changes, and not you statements like you make me more stressed out. You never help, but those I statements. And being very specific about the changes you've observed. Not vague and like, well, you just keep messing everything up, but I have noticed you missed a few medications this week. Is there a way maybe I can help support you and make that easier? And then always validate their feelings. Having these conversations can be complex and it can be really difficult conversations, so we really want to validate the emotions that arise. But Holly, what are some things that we should not be doing?
You mentioned one of them already, Jamie, and we should not go in using the word you. Whenever we go to someone and say, you shouldn't be driving, you are getting forgetful, you're just reckless, that is just automatically going to make them defensive. So we want to always start that sentence with I. We don't want to correct or to interrupt whenever we are having these conversations. And we certainly don't want to label or to diagnose. That's what the physician is for.
Thank you. And if you have a question or anything you want us to address, please put it in the comments or email us at caregiver@jameslwest. And we'll see you next week.